Friends, I am Dr. Amdekar, and in this video I am going to discuss about the role of cough remedies in routine medical practice. Friend, this is a very sensitive issue because medical science and the routine medical practice are at a bit of conflict when we discuss the role of cough syrups, and therefore we need to really look at it with proper understanding how we could largely follow the scientific principles but also are responsible to give relief to the patient. Friends, we all know that cough is a very protective reflex to expel an irritant, and therefore anything that suppresses a cough could be really counterproductive. And medical science has almost proved that there is hardly any evidence that the cough syrups work. However, the patients and the parents of children expect a relief from cough and cannot accept that there are no remedies at all in spite of advancing medical science. And this is a kind of a dilemma. We all know that we should not be treating cough, but we should be treating the discomfort caused by cough. So we need to relieve the discomfort, though we may not be suppressed the cough. And I think this is a clear communication required to the parents that we can make cough tolerable, and therefore if the cough is tolerable, then you need not treat the cough at all and there is no need of any cough remedies. And as happens commonly, when the cause of the disease leading to cough is known, then you focus on the treatment of the cause rather than just the symptom as a cough. For example, a child of acute pneumonia would also have a cough, but you don't need any cough remedies at all because you can cure the bacterial infection and the cough will disappear by itself. And same is the story of, say, an asthma. However, an asthmatic child who is uncontrolled could have very severe bouts of cough that upset the sleep pattern, and I think that is important to understand. In fact, most of the times the cough hurts the time of sleep and it upsets the sleep rhythm, and then the next day goes bad as well. Therefore, one must decide that if the cough is intolerable, meaning thereby that it disturbs sleep, then we need to do something to relieve the discomfort and ensure a good sleep, though the cough may not be suppressed. And I think this is the principle of using cough remedies, that you use the cough remedies only on SOS basis, only if the cough is intolerable, and often only at bedtime. However, in a typical asthma, when a child gets up in the middle of the night with a severe bout of cough, which is spasmodic cough, one could use certainly a bronchodilator, and today we advise inhaled route rather than oral bronchodilator, as oral bronchodilator often has side effects like tachycardia or cerebral irritation, and the inhaled salbutamol, for example, is pretty safe and does act within few minutes. So this is a right way of relieving the discomfort of a spasmodic cough. But many times the cough may not be spasmodic, as happens in a typical viral infection where a fever disappears in 2 days, but the cough may continue for a week or 10 days as well, and it certainly comes in the way of sleep. And to that extent, we need some relief, even when medical science says that there is no evidence of any cough syrup working at all. In that case, what should we do? We should really first try home remedies, and home remedies simply with adequate hydration, warm water, humidification with hot vapor inhalation are the simple methods which could help to some extent. And then one could use in little older children lozenges with or without active ingredient. Even the throat is kept moist would help relieving the discomfort of cough. And we have also ingredients like menthol or peppermint oil in lozenges that do help. And of course, you cannot use them in young children. And we are all aware of Vicks or Ayurvedic preparations like Honitus or Coughlet or Coughol are all available in the market, and they are worth trying, especially in older children who can just chew on them. However, sometimes a severe cough, like say pertussis, is a big challenge to control and give relief. There we may have to try some of the pharmacological agents, and I think a cough suppressant like dextromethorphan is something that I have used, and at times even combining with antihistamine. However, this should be used with caution, used judiciously, and only making a cough episodes tolerable. But this is important because, especially in an infant or a small child, a pertussis could be even fatal because of a severe laryngospasm. And at that time, one tries everything possible to save life, including even steroids, though there is a very little evidence that that would work. The science feels that when cough syrups work, it's a placebo effect and not the effect of any active ingredient in it. However, in clinical practice, placebo or otherwise, if it works and if it relieves the discomfort, it's worth using. And of course, we may have a better cough suppressants that are available today, which act peripherally and not centrally, and therefore they are pretty safe. And one of them are levodopa, and I think this is available even in Indian market. When it comes to expectorants, they are less required because older children who produce a lot of cough is the only indication, and guaifenesin is the best ingredient. One could use it with mucolytics as well, like ambroxol or bromhexin. Having said this, I again emphasize that as a routine, we should not use cough syrups at all or any cough remedies, especially in children under 2 or 3 years. We should almost not use them, but fortunately, we rarely need them. Of course, when you need them, you use it only when the discomfort is intolerable, and use it sparingly, use it very judiciously so that the side effects are not really seen and the benefits, whatever little, can be accrued. Friends, then remember this dilemma between no cough syrups are to be used, but however some relief is expected. We can marry these two contradictory statements and still follow rational medicine, and I hope my message is clear. Thank you very much.